According to Healthline 2018, 6.1% of American children are being treated for this certain disorder with medicine and has increased by 42% over the past 8 years. This disorder is known as Attention Deficit Hyperactive Disorder, or ADHD for short. This disorder can be perceived by some as a simple case of not being able to pay attention, someone who is often hyperactive or impulsive. Though these are symptoms of ADHD, they are complicated, which means more problems can arise from these few. Also, when ADHD is thought of, some people might think it only affects those who have it, but it does not. Although this may seem pessimistic so far with no positive mentions, these people can be helped through treatments to keep them in a positive, beneficial lifestyle. But who else does it affect if not only those who have ADHD? Well, it affects those around them, like their family. According to Gale 2018, in a study that was conducted on families with a member with ADHD, 79.2% of those families were dysfunctional. This means that if someone with ADHD was in someone else's life that is close to them, they would highly likely be affected from them. This could be through spending too much time supervising them with ADHD, or spending more than a usual amount of energy to contain their hyperactive behaviors. As mentioned, an example of this could be a child with ADHD who has a lot of energy and easily forgets things and is disorganized. The parent would then have to work to focus their energy to create organized living for the child, as well as finding methods to help the child easily remember things, like writing on a calendar, like things like important dates or important things to do. The parent would lose more of their time, leading to less important things done, which might cause a dysfunction in the family. As mentioned earlier, there are treatments for ADHD. The treatments consist of medications and therapies. When dealing with medications, there are two different types: stimulants and non-stimulants. Stimulants are fast-acting medications that lead to fewer symptoms, which, according to Centers for Disease Control and Prevention website, 70 to 80% of children have proven it true. Non-stimulants do not work as fast, but can last up to 24 hours based on the same website. Neither of these medications are better than the other. This is because they affect each person differently, so whichever has the most positive effect on someone is the best for them. With therapies, there are many different types, but there is one that is recommended first for children before other medications and therapies. As is stated on Centers for Disease Control and Prevention website, clinical practice guidelines from the American Academy of Pediatrics recommend that doctors prescribe behavior therapy as the first line of treatments for these preschool age children. This only includes a small group of people who have ADHD, and this is because they are young and they are more likely to be affected than older children and adults. The best treatment for older children and adults is a mix between medications and therapies, as mentioned by the Centers for Disease Control and Prevention website. To wrap up, there are many different types of treatments for the problems that consist within ADHD, but scientists have not found any cure to it. There are many problems that result from ADHD, and ADHD has no cure or perfect solution. The best response to this is best said by Maya Angelou. You may encounter many defeats, but you must not be defeated. In fact, it may be necessary to encounter the defeats so you can know who you are, what you can rise from, and how you can come out of it.